presentation. So Agnes is a paediatric dietitian who works in the ketogenic diets team at Great Ormond Street Hospital in London. Her day-to-day work involves helping patients with drug-resistant epilepsy and their families with the introduction and continuation of ketogenic diets. Outside of her clinical interests, Agnes has been a sustainability lead for the Dietetic Department for 1.5 years. And as part of that important role, together with other green AHPs and sustainability colleagues, she works on different projects within and outside of her department and looks for areas of improvement where a green touch is needed. So Agnes is going to talk to us about sustainability in dietetics in general, as well as sharing some information about projects she has worked on. Thank you, Agnes.
Thank you so much, Sarah, for that introduction. So yes, today we'll be talking about sustainability projects in dietetics. So I just wanted to kind of show you what I've done at GOSH together with other green AHPs. But I thought before we go over those projects, I thought why not kind of recap what we know about food and sustainability. And definitely, I'm not an expert. As Sarah said, my day-to-day job is ketogenic diets, so it's nothing to do with sustainability. So I'm still very much learning about that topic. But I thought, why not? Let's just talk briefly, about sustainability in food and what a sustainable diet means to us. So what I've done is I used this document created by British Dietetic Association, BDA. So most of the kind of food sustainability part of my presentation will be using a lot from that document. And that document is called One Blue Dot. And if you're interested in food, in sustainability, but also healthy diet, because BDA overall not only is talking about sustainable diet, but also healthy diet, please go to BDA website and download this document. It's a free document, and I think it really gives you a lot of information about sustainable diets. So just wanted to start that presentation with this really, really cool graph that is kind of making us think, I believe, because in a way, this is showing us kind of how does the food start and how does it get to our plate and what happens with food when it leaves our plate. So what we dietitians call a plate waste. And I think, the question is, do we ever wonder what happens to all the food that is ending up to our plate before and after the plate? And how does that all impact us and the environment? So first thing that I wanted to talk about is food production, because obviously we are getting the food onto our plate, but how is it impacting the earth? So overall food production contributes to 15 to 30% of total greenhouse gas emissions in the UK. And obviously all of us know that greenhouse gas emissions will be directly impacting environment and climate change. And then when it comes to, I think this slide is quite a sad slide, to be honest, but when it comes to food production and its impact on the environment, what does it kind of do? So first of all, we'll definitely be looking at some deforestation because we need to cut those forests out in term to have some livestock on them or plant something on them. Then we'll see some soil degradation as well. Definitely we might see some loss of biodiversity. We'll see depleted fish stocks. And in fact, what BDA kind of showed us is that overfishing and poor fishing practices have impacted on fishing stocks, with 90% of fisheries now fully exploited and or overfished. And marine vertebrate population has fallen by more than 1/3, and the ecosystems have been damaged. And when I say BDA, it is taken from the document, but obviously BDA did not do that research. They're basing their research, and there's a lot of references on that. And then, of course, when we're talking about food production, we'll be talking about water use, because we will definitely use a lot of water to produce the food. So then what does it look like in numbers? Around 70% of all human water use is used for food production. So I think, again, this slide, as I tend to kind of think about that slide, is a bit of a sad slide. But definitely, there are things that we can do to improve that, and we can look into our diets, and hopefully we can improve that as well. And the only other thing, because we'll be talking about waste in a moment as well, but obviously we're talking now about food production and then what happens before the food gets to our plate, but also what happens when we don't finish our food and it stays on the plate and goes to the bin. So the one blue dot showed that 9.5, and I appreciate that I'll have probably slightly different numbers later when we talk about the waste because it's just coming from two different resources. But around 9.5 million tons of all food produced in the UK is spoiled every single year. So that's quite depressing. However, the majority of that food, so around 3/4 of that food, is happening at our home. So I think even though it's quite depressing, it is quite positive that it's coming from our home in a way that we know that we can definitely change that and lower that number. And then just wanted to talk slightly about greenhouse gas emissions per person in the UK and showing where is that coming from. So overall, you can see that around 1/3 of all the greenhouse gas emissions per person are coming from kind of our diets. So in a way, it's not a massive number. The rest is coming from traveling, heating, manufacturing stuff. But 1/3 is something that we can definitely work on because it is something that we're doing on a daily basis and it is our diet. So now, if we're talking that is coming from our diets, the question is there a food that is identified biggest kind of problem of it all? And I'm sure that you've all seen that, you all know that, but I just wanted to show you that in numbers as well. So what are the foods that contribute to the most greenhouse gas emissions in the UK diet? So BDA identified, based on the research that they found, they identified three biggest kind of problems. So the first one and the biggest one will be red meat. So, and then the second one is dairy products. And I think it's all very much kind of linked together because when it comes to red meat production and production of dairy, you not only have to kind of have land and water for the livestock, not only you need to feed the livestock, so use the land and water to produce the, soya beans or whatever the cows are eating, but also they are producing a lot of methane. So it all sums up, and it is the red meat and dairy will be your kind of biggest problem when it comes to greenhouse gas emissions. And then surprisingly, the third biggest issue will be soft drinks and fruit juices. So you might ask why. There's a lot of energy going to production of that, but also at the moment, most of it comes in a lot of, plastic. It's all plastic bottles. So that's why it is quite high on that list here. And then when it comes to a question, right, so we kind of know what's causing the problem. Do we want to change anything about that? So in 2013-14, there was this survey that was called National Diet and Nutrition Survey, and they were trying to find out kind of what are the dietary habits in UK. And what do they contribute when it comes to kind of tons of carbon dioxide equivalents per person per year? And they showed that we're kind of contributing to 2.5, our diets are contributing to 2.5 tons of carbon dioxide. And as dietitians, I remember there was this really one cool study that was showing that a lot of people are actually underestimating the amounts of food that they are eating whenever they're reporting that. And they checked that for not only, people in general, but they also had a group of dietitians, and even dietitians were underestimating the amount of kind of food that they were eating. So taking that into account, it's underreporting, isn't it? So we might be contributing to even more, and the estimate is around 3 tons of carbon dioxide equivalents per per person per year. And then when people were asked about their intentions and if they would be willing to change their diets to reduce the impact on climate change, 50% responded yes, I would be willing to. However, then when you look at that survey and how much people were eating and what they were eating, more than 50% of us eat meat every single day, and then 80% of us eat dairy every day. So then I think now we need to talk about sustainable diet. What is a sustainable diet and what can we change in our daily kind of routine to help environment? So overall, when you look into kind of sustainable diet definition, there's no definition for that. There is no consensus just to say that is a sustainable diet, that is what it means. But what BDA did is they divided kind of the diet into 3 different pillars when it comes to sustainable diet, and they said that diet can be economically sustainable, socially sustainable, and environmentally sustainable. So what I'll focus on today is the environmentally sustainable diet. And that is the BDA kind of environmentally sustainable diet. That is the recommendation. And I think a lot of it is also kind of what me as a dietitian, what I would suggest to people, even if I wouldn't be interested in sustainability, it's probably what I would tell them to do anyway, because it's pretty much just a healthy diet. But let's go through different things here that are listed here together. So I think what BDA, the British Dietetic Association, focused on was reducing red meat, first of all, and then getting rid or avoiding processed meats. And then, of course, if you're taking away the protein source, as a dietitian, you need to think, right, so we need to put some other protein source, not to deplete people of protein in their diet. So they said prioritize beans and lentils and soya in your diet in place of red meat. When it comes to fish, we definitely want to kind of, when it comes to healthy recommendations, we'll always say that oily fish will be helpful because of the omega-3 content. But what BDA suggested is that whenever you're eating fish, if you're eating fish, then eat from sustainable sources, and that can be easily checked on the labels. When it comes to dairy, they said maybe not even limit the consumption, but it should be a moderate dairy consumption every day. And we know why, because it's contributing, to greenhouse gas emissions, the production of dairy. And then when it comes to kind of carbohydrates in your diet, so overall all your potatoes, bread, pasta, they didn't kind of specify that much about them. When it comes to healthy eating diet advice, they are recommending whole grain products just because of the higher fiber contents. And that's something that I would always kind of recommend as well to anyone. And then when it comes to fruits and vegetables, and I think that's actually quite interesting that that group is a group that when it comes to plate waste, it is something that usually is wasted the most, if that makes sense, because it's so perishable. It will go off so quickly. So whenever you look at waste, and whenever you look at numbers regarding waste, it's usually fruit and vegetables that are the highest in numbers. And BDA suggested to use seasonal fruits and vegetables, locally produced ones, just to limit those the carbon footprint of it all, and then to avoid anything that's pre-packed in a lot of plastic foil. And then when it comes to portion control, so in a way, it's just summarizing what they said in this left column here, that we should try to reduce our intake of animal proteins, so dairy and meat. And then I'd say just, in that place, increase the plant proteins in your diet, and then avoid, and again, that's pretty much healthy eating advice, avoid high fat, sugar, and salt foods. which as a ketogenic dietitian doesn't come, easy for me to say. Avoid high fat, because ketogenic diet is a very high fat diet, but obviously we're talking about a healthy diet. Hydration wise, BDA is recommending tap water, tea, or coffee over those soft drinks, because you remember from the previous table, actually soft drinks, they did have a high greenhouse gas emission level. And then I think really important to mention whenever we're talking about the diet, I think, all those like healthy eating pyramids and stuff like that, they always should mention about food waste as well. Because we should be mindful of that, because we remember that 3/4 of all the food waste is coming from our own home. And then BDA also compared different diets. So it was checks, kind of people were noting down everything that they were eating, and they were eating a pretty standard diet of whatever their choice was. And then it was calculated, and the greenhouse gas emissions were calculated from those diets. And you can see here that high eaters, and what was kind of specified as being a high meat eater, was eating over 100 grams of meat per day, are kind of producing the most when it comes to greenhouse gases. And then when you reduce the meat intake to 50 to 100 grams per day, you're reducing the emissions by 22%. So I think that's massive. So and then looking at even lower meat intake, so below 50 grams per day, it's dropping by 40% the greenhouse gas emissions. And then you can see vegetarians and fish eaters quite similar, and vegans lower, but not that significantly lower. So I think the biggest take from that slide and that data from One Blue Dot is nobody is saying you need to become vegan all of a sudden, and that's going to help, to save the planet. Even if you'll change your habits and you'll reduce the meat intake, this will make a massive difference. And then just to finish off, when we're talking about the diet, again, like I mentioned with the healthy eating recommendations and sustainable diets, I think it's always worth talking about waste as well. So that data is coming from 2015. I think the One Blue Dot was revised in 2020, just in case, but that data is coming from 2015, and it was showing that we're wasting around 10.2 million tons of food every year, and then that is 156 kilos of food waste per person per year. And you do remember the 3/4 that are coming from our own home, and what is really interesting is that most of it is avoidable, and we actually have control over that. And I think also what is interesting, if you summarize that, because we sometimes think, it was just one tiny piece of something that I threw away because I was just so full. But actually, when you summarize that and try to kind of see how much money you wasted over the whole year, it's almost £500. So that's, I think, really interesting. And then the last bit on that slide is that actually the second biggest, let's call it polluter, is hospitality industry and food service sector. So hospitals are in here. So now I wanted to, these are just two really short slides about kind of hospitals and what is kind of expected of us. But I think it's so important that actually NHS England is seeing the need for to be sustainable within NHS. And they're stating that every healthcare organization has a responsibility to provide the highest level of care possible for their patients, staff and visitors. That's pretty obvious, isn't it? But then they're saying this includes the quality, nutritional value, and the sustainable aspects of the food and drink that is served, as well as the overall experience and environment in which it's eaten. So I think it's brilliant, and it's massive that they are recognizing that. And then NHS food and catering services produce approximately around 6% of total NHS carbon emissions. So again, maybe the number is not extreme, and you're just, you're not doing that when you see that. But still, I think us as, AHPs, we have a duty to actually, look into that. And if there is any way to make your trust more sustainable and you have the power to do it, why not, even if the numbers are low? And then last thing, a very long, complex slide, but NHS England also kind of states, has some rules about improving sustainable procurement and reducing food waste, which is brilliant. And I don't want to go over all of that. It's all very complicated, to me at least. But NHS England is saying that organization actually must show that they comply with those six kind of pillars here. And you can see I just highlighted kind of those trigger words from time to time. So they're talking about food waste, but also plastic items. And I think it's just, recognizing the problem is massive. The other question, obviously, is what are we doing with the problem? But that's, well, in our hands as AHPs as well. Obviously, we're not responsible for everything, but I think we do have a duty in a way. And then when it comes to my journey to sustainability, so overall, I think our head of the department, she's quite brilliant, and she has this really smart idea where she said that even though she knows we're super busy and we're doing all our, all the work within our own specialties, she also wants to give us some opportunities in leadership. And she said, I want to have some leads in different areas in the hospital. And then I was doing one project that I'll talk about in a second. And I think she recognized that project was actually very much kind of a sustainable project. And she said, I think you would be good at that, as a sustainability lead in our department. And that's kind of how I became interested in sustainability and how I started doing some projects. But obviously, I appreciate that there are so many ways on how you can, start working in sustainability within NHS. And now just wanted to show you some projects, maybe just to kind of give you an idea of what Gosh did in the past, but also maybe to inspire you, hopefully, or maybe, after that talk, you'll say, actually, sorry, I think in this project you should have done something differently. So I think it's all learning from each other, and that's really great. If you have any comments on those projects, please feel free to kind of tell me off. So when it comes to the first project, so the one that made me interested in sustainability and why I became the lead, for our department is what I call reusable bottles audit. And I think my whole team is just laughing about bottles because I've been talking about bottles for the last maybe 3 years. And every time, yeah, I say, the word, they will just laugh at me. But I think it's an important project. So overall, we have a special feeds unit in our hospital, and that unit is producing a lot of different feeds because we, as dietitians, we're using kind of those ready-made feeds that are coming in plastic bottles, but also we have a lot of powdered feeds that we need to mix with water. And that's what SFU is doing, just sending those feeds to all the wards. So we're sending them to over 100% of, sorry, not percent, 100 patients every day. And it's around 1/3 of all GOSH patients. So you can imagine that the numbers are quite big. And then what is quite, I think, quite good is that we're using reusable plastic bottles of different sizes. And my kind of job initially was just to check how many bottles, because in a way those bottles are being sent to the ward, and then we're sending 24 hours worth of feed, and then they should be coming back to us, and we should be able to wash them in those special kind of dishwashing machines, and then we would reuse them and send them again. And we would ideally not waste any bottles on that. So what I was calculating is the number of bottles that were not coming back. And what I found was that around 2,500 bottles were not returned to the SFU in period of 1 month, and that was back in 2020. And I think always just whenever you're doing a project around sustainability, but you don't have a lot of people interested in sustainability, which I think I was quite lucky with, because the head of our department is quite interested in that. But if you don't have someone who's interested, I think it's really good to always show them how much money is being wasted. And so whenever you're speaking to anyone high up who's not really interested in sustainability aspect of your audit, you can always, show them the financial aspect, and then they'll start listening to you. So what I did is I, of course, looked at the financial aspect as well. And the financial loss that we were looking at was £1,500 per month, which in a way, in a massive hospital, maybe didn't kind of cause anyone a headache. But when you add that up, it's £18,000 per year. And then what's more, our special feeds unit ordered almost 35,000 bottles for that tax year. And them ordering more bottles means that they were not getting them back from the ward. So then that costed £21,000. So you can see that you're looking at around £40,000 of wasted money. So what we did back then, having all those numbers, is I spoke to, matrons on the wards, the kind of people high up in the hospital, and I presented all that data. And then we did some surveys on the wards where we were asking nurses if they were even aware of those bottles being reusable, and kind of we were making them aware that they were. And then I've produced so many posters, and my colleague, a dietetic assistant, she was just helping me with those posters. I think she was making them, but also I remember running around the hospital with her and just putting them everywhere. And then I also had a great help from all the dietitians from the whole department who agreed to do some bedside training with nursing staff on the wards. And I think we were quite successful because next year, special feeds unit, we saved £10,000 next year on new orders. So it means that we were getting those bottles back. And then some other projects that we looked into. So and just to show you again, it's not you by yourself, you will get help. So we at GOSH do have dietetic students coming to us pretty much all the time. And I was working with two students, Rueda and Alana, and they were looking into feed wastage because we knew about the bottles, but now we wanted to find out if we're wasting the feed. So what we did is, Alana and Rueda, they spent 3 days in the SFU, and they were calculating how much formula was coming back in unopened bottles, meaning that someone did not even use that bottle. So it's not maybe showing you the overall 100% of waste, but it's showing you some waste in a way, because obviously, open bottles were probably open and there might have been some waste, but we were looking specifically into unopened bottles. And they found that, we were wasting a lot of formula, they found out, and that overall estimated avoidable wasted per year, and that's an estimation, of course, because they were basing everything on those 3 days, is almost £7,000. And then when it comes to the environmental cost of 3-day feed wastage, and again, it was very hard to calculate that because it's a formula, but the formula is based on cow's milk. So I think we were using cow's milk to calculate everything, and we've wasted 33 liters of the formula over 3 days. And then that was estimated annual wastage of 4,000 liters of, in a way, cow's milk. So that's massive. And then the outcome of that was new, more accurate equipment for SFU that we're still working on, unfortunately, because it's really difficult to get one that is kind of, approved for the hospital. So I'm not sure if we'll get there. But also we raised awareness across the whole department because Royd and Alana did present that data for the whole department. So I think the lesson learned, for me at least, from that audit is that even though you might find a problem and you have all the data to show the problem to everyone, you might not be able to solve that immediately, or you might not be able to solve that at all because we're struggling with that equipment. And I'm not sure if we'll get there because, we're working in a hospital and there are certain rules about hospitals. Then again, one more project that is showing that it's not always you who have to do all the work. You might be advising someone on some things. And we had Nicole, who is a physio student, so she's not in dietetics, but she was just directed to me by our educational lead, and she was creating a training program for our kind of learning platform at Gosh around food sustainability. So overall, she was just kind of, shadowing me for a few days and asking me questions about how it all works. Then we had another student, so you can see that we're working with a lot of students. um, and we had another student who was doing her dissertation with us, Mary. And Mary was looking at, because we not only have the special feeds unit, but we also have something that is called a diet kitchen, where we are producing food that is allergen free for some patients that are very allergic to different things. And we were just she was doing a service evaluation of the diet kitchen and how it works. But within that service evaluation, she also was looking at plate waste. And what she found was that the total plate waste of the 41 audited meals was at 51%. So that's massive. That's crazy, isn't it? That 50% of all food that was served was just wasted. And she looked into different reasons, different diets. Um, and as you can see, a lot of that was vegetables, so they were thrown away. But also, when it comes to reasons, sometimes we didn't order correctly. Sometimes patient's clinical condition didn't allow them to finish, and often the patients were saying, "I wasn't given a choice, so I just wasn't feeling like eating what you served me." And I think from that audit, we had meetings with diet kitchen managers, and we were trying to figure out what we can do with that plate waste, and we did a lot of education as well. And then I think, not everything is to do with numbers. There are some projects that are also very artistic in a way. So I was helping an artist that came to Gosh, Young Suk, who was doing a project called Seasons of the Mouth, and she was recording a short film about kind of how kind of impact of our diets and kind of how sustainable our diets are. And she was talking a lot about seasonal vegetables and diets, and she actually involved children in that. She partially filmed that in our diet kitchen, and then this movie was displayed at Gosh on one of the corridors, and it was just lovely to see that. And then just wanted to show you that again, it's a massive community that you're working with when you're working, with sustainability. You have so many amazing people that are so passionate about the stuff that they're doing, and that's our last year's kind of effort for AHP week, Greener AHP week, where I think all kind of Jackie did an amazing job, Jackie on the right side, as I'm sure you know Jackie. And yeah, that is just a picture. We had a stand in the lagoon, and we had a lot of different cool things, and here sustainable kind of period products in our hands, but overall, as you can see, a lot of fun, great day, a lot of people actually really interested and asking a lot of questions that day. And then something that I'm working on at the moment is implementing reusable coffee mugs in our kind of kind of, oh my God, what is the name of it? A place where you can order food in the hospital. Canteen. Thank you so much. Thank you. In our canteen. So overall, we want to allow people to bring their own mugs and limit the use of the single-use mugs in the canteen. And overall, we have all the approvals. So now we're just looking at because we did, you need to think about things like infection control and legal stuff when you're thinking about a massive organization that a hospital is. So we have all of that approved, and we're just waiting for a start date for that. So hopefully we'll be able to implement that, and we're also hoping for a discount on those cups. And I think someone recently said to me, actually, the cups, when you're bringing your own mug, should be like normal priced, but if you're not bringing your own mug, you should pay more. So maybe we'll do it that way. Who knows? And then just a fun fact around, well, it's not really fun, is it? But paper coffee cups they are lined with plastic, and it takes them approximately 30 years to decompose. So massive, I think. And then I think it might be the last project that I wanted to mention, Meatless Mondays for Veganuary this year. So what we did is, with help from David, our catering manager, we launched Meatless Mondays in the canteen for the hospital for the whole month to celebrate Veganuary. And I think Charlotte, who was on the picture, and who I'm working with closely, and she's part of the sustainability team. She wanted to actually calculate, carbon footprint of that, but we don't have the data yet, so I couldn't bring that to you. And I think, yes, sorry, last slide, I did lie. So my last slide is about the fortnightly newsletter that I do for anyone who's interested, really. So I send that to the whole department because they don't have a choice. They need to read that. But also outside of my department, I also kind of, ask people if there's anyone interested to give me their email address, and then I add them, and I just do kind of positive green news. I just try to look for something positive that happened, and I just send that out to a lot of people at that point. And thank you so much. I think that's all from me.
Wonderful. Agnes, that was an amazing journey through that range of topics and projects that you've shared with us. And on that final slide there, people can see some information about further Greener AHP Week events. I hope you've seen all the claps that are coming in for you, Agnes, and some thank yous starting to appear in the chat as well. Jackie, are you all right to stop the recording now?